I took the first in-person requirement of my digital health navigator course. I thought it was just a course. Apparently, it's a certification. Surprise, surprise. But let's talk about a couple of things related to health literacy. Now, when I think about health literacy, and I'll look over to confirm the definition shortly, I think about that as how do I, as my own person, understand the information that is presented to me related to any type of health information. And from an organization perspective, or a doctor's office, or a wellness professional, or anyone that dips their toe in health, how are they making it easy for you to find, understand, and inform the decisions that you as the individual need to make regarding your health? And that is a very, very important thing to consider. I have experienced this a lot from the perspective of a patient, from my own diagnosis journey to seeing my loved ones interact with the healthcare arena. And I think looking at the update or the change from Healthy People 2010 and Healthy People 2020, I want to read it verbatim. It says the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Now, I can tell you on a regular basis, I know that this is not the case. I see it whenever I am at the hospital. I have seen it, like I said, with my own family members, and I cannot begin to tell you how many times I have even asked my mother, did you understand what the doctor told you today at your visit? And her response is always no. Or she will tell, will insert healthcare provider, I need to go back and ask my daughter what this means. And it's always interesting to me because it's one thing to have an advocate, but it's also interesting to me that they're not necessarily taking the time to explain it in a way that they understand. This reminds me of when I went into a bakery that employs individuals who have disabilities, and I am a very direct communicator, and I said, "Hi, I need this in my order. This is the time that I need it. What questions do you have?" And they kind of turned their head at me, and I said, "Is everything okay? Did I mess up something? Is it?" They were like, "No, no, no. I just appreciate you telling me exactly what you needed and what time you needed it for, and then you followed up by asking me if I had any questions." And I was like, okay. While I didn't think of it as anything out of the ordinary, they told me one thing that people often forget is clear is kind. And I can't tell you how many people will come thinking that they have an understanding of something, or they go back and forth all the time about what they want and what they need, and then I get 5 stories about why this is important, and sometimes all I need is the order because I have to get these things out and it's a requirement for our program. And you might be wondering, what does this have to do with health? The same thing can apply from a health perspective. Here's an example. So I tell this to people all the time, specifically when you are going to the doctor. Have a journal. I have one. I created one. If I have any symptoms, I write those down. How long it was, when did it start happening, does it give me pain? Questions. I have had very poor experiences navigating the healthcare space where I tried to give absolutely every detail and I was cut off within 30 seconds. If I don't need all that. Okay, well, if you don't need all that, how are we going to figure out my health? How are we going to do that? So I had to learn how to bluff it, or the bottom line up front. And then from that perspective, if said professional, doctor, whomever needed more information, I let them ask me. But I always wrote down everything that I had so that I didn't have to rely on my own memory, and I had the information right there. And I would literally put my journal in the middle of us and say, should you have any additional questions, I'm going to be referring to my journal. Now, we are also entering into digital health literacy, and that is because we have so much technology, even the device that's in your hand, we are consuming so much more health information, which is riddled, unfortunately, with mis and disinformation. And it's really important for you as the individual to understand what you are taking in. Now, when I come here to look at digital health literacy, I am reading an article by Bond et al. Titled Digital Health Literacy, a Concept Analysis. And essentially in this article, one of the things that I want to highlight is they are talking about the advancement of technology, as I also started with, but they are saying that digital health technology is not only broadening access to medical services and fostering patient engagement, but also expanding healthcare horizons, ensuring safer and more cost-effective treatments, especially for those previously underserved. This information is also altering the dissemination of health information and the dynamics of health communication. It changes individuals from passive participants in the therapeutic relationship, which traditionally involved information imbalances between patients and healthcare providers, to active agents engaged in health self-management. However, digital services and technology alone are not a panacea for everyone, as individuals who require more services are generally part of the digitally vulnerable population. The ideal vision for digital health may remain an unrealistic ideal if steps to equip people with digital health literacy are not implemented. Now, who is that going to impact the most? The vulnerable, people with disabilities, people who don't have access to broadband internet service, people who don't have access to computers, people who have low health literacy, people who maybe language is they have limited English proficiency or LEP. We have to think about that. And as I am walking through this program, in 4 modules in a in-person session, I have already recognized how much technology is used that I just don't think about because I'm used to it, because I can go back and forth very easily. But that is something that I have to recognize as a privilege that I have. So it's really important to me to practice patience and ensure that me, as someone who creates content, is creating it in a way that is accessible, that works very hard to use plain language, and that I am providing resources or access to information in a way that someone will understand, or I can direct them to that. And it was important to me to make sure, for example, in the Medicine is in the Story, I have research articles, but I also have media examples, and I have general health journals or health articles from magazines or what have you, or YouTube videos. That, for me, is encompassing that to be able to provide people with various forms of media so that they can take in information in the way that is best for them. So I want you to take some time to reflect on this and think about the ways that maybe you as a practitioner or someone in the health and wellness space, are you providing ways to make sure that you are supporting the development of health and digital health literacy with the people that you serve? And are you making it easy for people to be able to interact with the information that you are providing?